Greetings, everybody. Keith here. Hoping everybody's having a good day, enjoying life, living life, loving life. I remind everybody hit that like, share, and subscribe button. There's a PayPal link down below for anybody that wants to share some love. And of course, there's the StreamYard link down there for anybody who wants to join the panel. So we're going to talk tonight about the health statistics and what are they and what is your interest. And those of you that know me know I talk about that enumeration at birth all the time, the Social Security number, birth certificate, and all that. And that's essentially what we're talking about again tonight. And we're going to show you some things here under the Social Security Code, Social Security Act, and hopefully point out how some of this stuff is working. And the first thing I want to point out is Title 11 of the Social Security Act. And so let's pull this up. And we're going to go down here. This is Social Security legislative history. This is an archival or historical document and may not reflect current policies or procedures. However, this is still current. Section 1101 when used in this act, and it's a set of definitions. This is 1101, 42 U.S. Code 1101. And Section D says, nothing in this act shall be construed as authorizing any federal official, agent, or representative in carrying out any of the provisions of this act to take charge of any child over the objection of either of the parents of such child or of the person standing in loco parentis to such child. So once mom or dad pipe up and object, that's an objection. To take charge of any child over the objection of either of the parents of such child. Effectively, what's going on is you are willingly giving up your authority, like I said before. Yep, where it begins, doc's order, data in, data consultants. When they need the information, they say you're required to give it to them. No, you're not. There is a certain comprehension that needs to be had, that when you give them that information on those forms and it's listed as first name, last name, and that is a legal name, whereas concise English doesn't allow you to express it in that manner. It is succinctly expressed in certain characteristics so that you know it is not the legal name. And that is with them hyphens and the full colon stops. Over the objection of either parents of such child. So if there's something going on that the parents don't know, then somebody is taking charge of the child, and mom and dad aren't objecting because the taking charge of the child isn't even known. It's been misconstrued. See, this comes again to the competency of understanding plain writing in government documents as it relates to the minimum birth registration requirements. and them telling you you have to give them that information. No, you don't. If you give them any data elements, you have the right to express them truthfully and not in their fiction. So let's take a look at the next thing. Remember, I've showed you this before. This is the vital records and vital statistics in the United States. Uses, users, systems, and sources of revenue. Conducted for the National Committee, and get this, folks, this is 2018, and I'm sure this document went through a lot of processes before they actually made it public, and all these people profess that they're qualified, and yet it says conducted for the National Committee on the Vital and Heath Statistics, Subcommittee on Population Health. So nobody, even the publishers, all these qualified people that know what they're talking about, can't make sure that their document is correct. I know that's nitpicking, but that's on the first fucking page. So let's pay attention and understand there's probably many other mistakes throughout this entire document if you just look for them. So we go down and it says vital records and vital statistics, da-da-da-da. This report was prepared under contract by R. Gibson Paris, MD. Under contract. Everything is contract. Everything is commercial. There's one form of action, civil. All crimes are commercial. National Committee on Vital Health Statistics membership and lead staff. So this is their membership and lead staff. Is that the population of the United States? If that is the list of their membership and lead staff, that's membership. See, if you're not a member, then what are they doing collecting data elements on you? The National Committee on Vital and Health Statistics serves as the advisory committee to the Secretary of Health and Human Services. Advisory. On health data, statistics, privacy, National Health Information Policy, and the Health Insurance Portability and Accountability Act, HIPAA, which is 42 U.S. Code 242K, subsection K. We're going to take a look at that. The committee also serves as a forum for interaction with interested private sector groups on important health data issues. Like I said earlier, you're a data consultant, and that interested private sector group is yourself. And remember, 1 U.S.C. 1 says the singular imports the plural, and the plural imports the singular. And so as yourself, as a family group of the private sector, you have an interest because you're the one that's giving all the data elements on important health data issues. Its members, its membership includes experts in health statistics, electronic interchange of healthcare information, privacy, confidentiality, and security of electronic information, population-based public health, purchasing or financing healthcare services. Purchasing being the creation of a debt, financing being the settling of a debt. So the creating of a debt or the settling of a debt, healthcare services. Integrated computerized health information systems. Health services research. Consumer interest in health information. Health data standards. This is all informational. Epidemiology. Epidemiology, the only medical term in there. And the provision of health services, such as a spell of illness, where in the first day you receive inpatient hospital services, creating the state's vital statistics jurisdiction. 16 of the 18 members are appointed by the HHS secretary to terms of 4 years each. That's the Health and Human Services. 2 additional members are selected by Congress. Tells you all this background. Overview of birth and death registration. This is what we're, first thing, that's what they're talking about. Findings. Overview of birth and death registration. Uses and users of identified birth and death records. Again, the individual's name and number identify the record, not the living soul, not the man. Uses and users of de-identified natality. Oops. Uses and users of de-identified natality, birth, and mortality, death, data sets for information systems. Background. The National Committee on Vital and Health Statistics serves as the advisory committee. Again, none of this stuff is law, folks. Not one bit of it can we find is law. To the Secretary of Health and Human Services on health data, statistics, privacy, standards, National Health Information Policy, and the Health Insurance Portability and Accountability Act. In this capacity, it provides advice and assistance to the department and serves as a forum for interaction with stakeholders on key issues related to population health, standards, privacy and confidentiality, and data access and use. They don't have access and use until you give it up. Because the National Vital Statistics System plays a critical role in monitoring the health of the nation, conducting public health surveillance, understanding the effectiveness of the healthcare and health financing system, and supporting business and commerce. The NCVHS is exploring the state of existing NVSS and identifying ways to improve the system. That's the National Vital Statistics System. Information system for those data sets. Sources of revenue for vital records is the revenue, is they take the definitive paper form and revenue it into an electronic form. How do we transform today's vulnerable vital records data collection network into a network of state systems that produce accurate and timely information supporting a breadth of local, state, and federal data needs? The breadth of local, state, and federal data needs is in that graph. The death certificate, we're going to go down and take a look at that. Where over here, it shows us over 500 users, greater than 500 users, certified users. So when you give out information into this system, you've got over 500 users that are using it through all these different government agencies and everything, local, state, and federal. State Health Department, Vital Records Office, Electronic Death Records System, Vital Records System, and this is all in regards to the Numident, full DMF, public DMF, domestic master files. Federally funded state benefits paying agencies. They go from the Numident. The Numident is your financial statement on everything. CDC, state death files, death file, federal government. This is all meant for the National Archives so that they can use it in a continuing education, research, and development project known as public education and social services. So let's take a look. 42 U.S. Code 242K, what they mentioned in that document. National Center for Health Statistics. Establishment, appointment of director, statistical and epidemiological activities. Excuse me. There is established in the Department of Health and Human Services the National Center for Health Statistics, here and after in this section referred to as the Center, which shall be under the direction of a director who shall be appointed by the Secretary. The Secretary, acting through the Center, shall conduct and support statistical and epidemiological activities for the purpose of improving the effectiveness, efficiency, and quality of health services in the United States. Remember, where's the United States, folks? Should tell you all you need to know there, but just to expand upon it, what is the definition of services? The term service means public health service. What does center mean? Center, there is established in the Department of Health and Human Services a national center. That's what we just read. So it tells us there is a center for health statistics. That's the center. It has nothing to do with your medical. It has to do with the statistics only. The identifications and numbers and quantities, supply and demand, and the effectiveness of the cost and expense and commercial remedies and this and that. So the Secretary means the Secretary of Health and Human Services. Duties in carrying out this subsection A, the Secretary acting through the Center shall collect statistics on the extent and nature of illness and disability of the population of the United States. So they're classifying it as a disability first, folks. They didn't classify you as you and your abilities. The extent and nature of illness and disability, because you were born in a spell of illness. The extent and nature of illness and disability. The extent and nature of that spell of illness is inpatient hospital treatment in a foundling hospital where mom registered, pledged the data elements without maintaining the rights, title, and interest to that property, and gave it to them unknowingly, being converted into a legal name and creating a legal estate as a business of the United States. Of the population of the United States. The population of the United States, folks, there's no birth registration in the United States. So how can there be a population of the United States? Anybody? Anybody, please tell me. If there's no birth registration in the United States, and the United States is in fact located in Washington, D.C., I'd like to know exactly where in Washington, D.C. it is, and how big it is by space and area, so we can determine whether the statistics hold up as to the population of the United States, having being 380 some million people, and somehow they have to fit into 10 square miles as Washington, D.C., even if it does encompass the entire area and space of Washington, D.C. Can we fit 380 million people in that little tiny place? I urge people to start asking questions and find out the answers, because the numbers just don't add up. Including life expectancy, the incidence of various acute and chronic illnesses, and infant and maternal morbidity and mortality. The impact of illness and disability of the population on the economy of the United States and other aspects of the well-being of its population or of such groupings. Environmental, social, and other health hazards. What are the social hazards? The social hazard is that in this socialist society, calling itself a democracy while promising a republic, is being used as a tool to dumb down the Americans through the very social platforms that they engage in for a popularity contest, including the public education system. And this is why we have the queen and the king of the senior class. This is why we have competitions for student senate and all of that. This is because we're being trained in a popularity contest. Determinants of health. You are the determinant of your own health. Know thyself, heal thyself. If you don't know yourself, you hand yourself and your health over to them. Health resources, including physicians, dentists, nurses, and other health professionals. What about the very people that they're using as patients? That is the main source for any of them by any specialty or type of practice, and the supply of services by hospitals, such as a spell of illness. That's a service. It's known as inpatient hospital services of an extended care facility, home health agencies, and other health institutions. Utilization of health care, including utilization of ambulatory health services by specialties and types of practice of the health professionals providing such services, and services of hospitals, extended care facilities, home health agencies, and other institutions. Again, if you're only providing the data elements, how is it that service contract applies to you as if though you're a contractor? Healthcare costs and financing. Healthcare costs and settling of those costs. Learn these terms so you can recomprehend what this is saying so you can help them out, as well as help yourself, of course, including the trends in healthcare, prices and costs, the sources of payments for healthcare services, and federal, state, and local governmental expenditures for healthcare services, and family formation, growth, and dissolution. So that enumeration at birth, folks, is an offer and acceptance in formation of contract. Let me pull that up real quick. Uniform Commercial Code 2-206. Offer and acceptance in formation of contract. You see that? You see what that is? That's information. It's a different way of showing you what's actually going on through a conversion. You have an offer and acceptance. The data elements are part of that acceptance. That's the information. And it's of a contract. Look at the form. They're asking you to sign. Contractors sign. Beneficiaries are not required to do anything except accept the benefit, unless otherwise unambiguously indicated by the language or circumstances. Unless otherwise unambiguously indicated by the language or circumstances. Saying that ambiguously, everything is an offer to make a contract, and shall be construed as inviting acceptance in any manner and by any medium reasonable in the circumstances. So when I went to the emergency room and I looked at that document, the very first thing on top of it said sales agreement. I said, okay, let's read this thing and see what the terms and conditions are. When I read on the back, it said customer agrees, basically in this, not verbatim, but the basic sense of what they said on the back of that agreement was that the customer agrees to make third-party payment so long as it's understood that the customer or credit is given to the customer's account. Customer agrees to make third-party payment so long as it's understood that credit is given to the customer's account. That is a very basic, simple directive that if we'd have been taught that a long time ago and how this system works, so that that's all we got to do is give that directive, we don't have to worry about much. See, we've been taught to remember all this other shit because it's based on a money system when there's a credit system already available. So let's go back. Family formation, growth, and dissolution. So if you've got a family formation and you're providing them information, it's creating a record, a system of records that's keeping track of individuals and members of groups. The families, that's the statistic record. And it's growing, and there is no dissolution. It's meant for the archives in the National Archives, Library of Congress. Shall undertake, because they have to undertake an oath under the Constitution. Take an oath under the Constitution. Shall undertake and support by grant or contract. Okay, the contract has warranted information assuring that everything will go according to plan, and that if it doesn't, there is a remedy, and here set forth is that remedy shall have action ensued or whatever. Whatever your indemnification agreement or arbitration agreement you want it to be, you write it out. That's the contract. By grant, what is grant? Grant is an assurance. It's the same thing. By grant or contract, they're both basically the same thing. It's an assurance. Again, those terms and conditions are what you need to learn in those different situations. Research, demonstrations, and evaluations respecting new or improved methods for obtaining current data on the matters referred to in paragraph 1. This is why it's so important to understand the communications and how to hold them with your public officials, and the importance of them maintaining those communications with you, and not just saying, well, I don't know, I'm just doing my job. Again, as we saw earlier, one of the main duties of their job is to hold themselves accountable. And that's the last thing they'll do. May undertake and support by grant or contract epidemiological research. This is the medical part. When it comes to the record, shall undertake and support research, demonstrations, and evaluations respecting new or improved methods for obtaining current data, the record. That's paramount. That says shall. And this says may undertake and support by grant epidemiological research, demonstrations, and evaluations on matters referred to in paragraph 1. So this one is a may to support what is already in 1, which is shall undertake and support research, demonstration, and evaluations respecting new or improved methods for obtaining current data, not your health. It has nothing to do with your health. It has to do with their research product, which is the record system. The statistical record system is a logistical research product. And that's it. You keep partaking in that research voluntarily. The voluntary consent of the human subject is absolutely essential, and you keep volunteering and then crying and complaining that they're violent. No, you volunteered. May collect, furnish, tabulate, and analyze statistics and prepare studies on matters referred to in paragraph 1 upon request of public and nonprofit private entities under arrangements under which the entities will pay the cost of the service provided. Amounts appropriated to the Secretary from payments made under arrangements made under paragraph 4 shall be available to the Secretary for obligation until expended. Until expended. So again, it sounds like you give them something up front as a value. Again, that's a surrender of that state document by placing a value on it that's going to supersede everything they've got. And that holds the obligation until that is expended. If you've got the credits and you know it's a never-ending credit system because credits revolve, then what are you waiting for? Oh, because you don't know yet. You're not doing your research. So perfect little point for me to point out to everybody. Don't believe me. Don't believe the neighbor. Don't believe the government. For crying out loud, do not believe your mother. Do your research so you know. Let's see here. Cooperative health statistics system. For the purpose of producing comparable and uniform health information and statistics, there is established a cooperative health statistics system. The Secretary acting through the Center shall coordinate the activities of federal agencies involved in the design and implementation of the system, meaning that it has to be in contract form. It has to be granted or contracted, just like it says, undertake and support by grant or contract. Research, development, demonstrations, evaluations respecting the system, not your health. Respecting the system, not your health. Respecting the system, not your health. Makes grants to and enter into contracts with state and local health agencies to assist them in meeting the costs of data collection and other activities carried out under the system. And therefore, I tell you, if they don't give them data collection, the only cost they have is on the meeting the cost of their own data. Review the statistical activities of the Department of Health and Human Services to assure that they are consistent with the system. That's again a grant or a contract. States participating in the system shall designate a state agency to administer or be responsible for the administration of statistical activities within the state under the system. The Secretary, acting through the Center, shall prescribe guidelines to assure that statistical activities within states participating in the system produce uniform and timely data and assure appropriate access to such data. Produce uniform and timely data. Again, if the data comes from you, then who are they to demand it from you if you're not participating in that system? See, it's the states that are participating in that system. They don't have any right to tell you that you're required to give them data elements anywhere. They have no right to tell you you are required to identify yourself. Period. Federal state cooperation. Once again, don't ever let any one of them tell you, well, we don't have anything to do with the federal code. You just ask for my motherfucking social security number, bitch. You do have something to do with the federal code. Federal state cooperation. To assist in carrying out this section, the Secretary, acting through the Center, shall cooperate and consult with the Department of Commerce and Labor and other interested federal departments or agencies and with state and local health departments and agencies. For such purpose shall utilize insofar you are the utility company. You are being utilized insofar as possible the services, the personal services of you or facilities of any agency of the federal government and without regard to Section 6101 of Title 41. That agency of the federal government is a United States business known as a United States citizen, being utilized and to facilitate and provide personal services of documentation and the data elements needed therein and the signatures needed thereon. Without that, they have nothing to keep a record of except, again, themselves. Of any appropriate state or other public agency and may, without regard to such section, utilize the services or facilities of any private agency, organization, group, or individual in accordance with written agreements between the head of such agency, organization, or group and the Secretary, or between such individual and Secretary. Just by signing those written agreements, you enter yourself into that contract. You better know how to qualify your place in that contract on the contract. In accordance with the payment, if any, for such services or facilities shall be made in such amounts as may be provided in such agreement. It says payment, if any, telling us and allowing us to read between the lines that there are things that you get without payment because it says payment, if any. So what are those services? Collection of health data, data collection forms to secure uniformity in the registration and collection of mortality, morbidity, and other health data. The Secretary shall prepare and distribute suitable and necessary forms for the collection and compilation of such data. Again, they have no authority to do so. To secure uniformity in the registration and collection of mortality, morbidity, and other health data. Health data of who? Health data of who? See, there's the thing that's missing. The Secretary shall prepare and distribute suitable and necessary forms for the collection and compilation of such data from who? You cannot be compelled to give them data just because they want it or say they need it to compile data for statistical purposes. Registration area records. There shall be an annual collection of data from the records of births, deaths, marriages, and divorces in registration areas. No person shall reside within the zone except federal, state, or municipal officers or agents whose resident presence is deemed necessary by the board and have therefore pledged security, interest, and collateral in the contract under which they were hired with an oath or affirmation. The data shall be obtained only from and restricted to such records of the states and municipalities. From, the data shall be obtained only from and restricted to such records of the states and municipalities and not the United States. Which the Secretary, in his discretion, determines possess records affording satisfactory data in necessary detail and form. So the first thing they do upon that enumeration at birth is the creation of the legal name, which is a first name and last name, which is a different form of the given name and a family or group name. You see what happens by the grammar folks. Affording satisfactory data in necessary detail and form. So the detail and form that's required is the legal name and not the spiritual. And therefore, if you can't possess or provide the actual definitive proof of the necessity of creating that in somebody else's name other than your own, merely because you supposedly have some kind of protective interest in making sure that that other person has something in their name and then qualify it as yours, then it's not really theirs. And then when you use it against them without educating them how it's used to begin with and that they have access to it, then how do you expect them to qualify its use and actually use it? Again, it goes to the premise that if the United States is going to grant or confer a nationality of a United States citizen upon somebody and not give them the information that it's a United States business and that's here, and here's how to run it and everything, and not properly educate. How the hell do you expect that to be properly protected? See, there's a problem with the ability and the absolute reason and logic that they should have an ability to protect that person internationally, as it goes by their code, internationally protected person created by the United States. But it's got the data elements from the state or municipality. Well, where is it in the record of the United States then? See, there's no birth registration in the United States showing that it started out as a United States business, right? But it's known as a United States business. That's for damn sure, right? No person shall reside within that zone except federal, state, or municipal officers or agents whose resident presence is deemed necessary by the board. The Secretary shall encourage states and registration areas to obtain detailed data on ethnic and racial populations. The Secretary shall encourage states and registration areas. Well, if it said states and municipalities here, then the states and registration areas would be the municipalities. To obtain detailed data on ethnic and racial populations, including subpopulations of Hispanics, Asian Americans, and Pacific Islanders with significant representation in the state or registration area. Each state or registration area shall be paid by the Secretary the federal share of its reasonable costs for collecting and transcribing its records for such data. So they've already been paid, see, for collecting and transcribing those data. Transcribing. Did they change the data elements in that transcription? Okay, so here's the part we wanted to look at. This is part K, National Committee on Vital and Health Statistics, establishment, membership, term of office, compensation, functions, consultations of Secretary with committee and professional advisory groups. The professional advisory groups, you'd be astounded that when you go around professing as mommies and daddies that you're United States citizens, and that makes you a group, whether you're a single mommy or a single daddy, and you're professing that you're a United States citizen. Professional advisory group, advising everybody, I'm a United States citizen. I'm a United States citizen. I'm a United States citizen. I'm a resident. I don't advise you to do that anymore. There is established in the office of the Secretary a committee to be known as the National Committee on Vital and Health Statistics, hereinafter subsection referred to as committee, which shall consist of 18 members. The members of the committee shall be appointed from among persons who have distinguished themselves in the fields of health statistics, electronic interchange of healthcare information, privacy and security of electronic information, population-based public health, purchasing or financing healthcare services. And I'll remind you that's purchasing, the creating of debt, or financing, the settling of debt. So purchasing, which is the creating, or financing, which is the settling of healthcare services, which is a debt, a cost, an expense. Integrated computerized health information systems, Health services research, consumer interest in health information, health data standards, and this is the health data standards. We have a variance from categorical pretreatment standards that are fundamentally different in factors or have fundamentally different factors in nature. Epidemiology and the provision of health services. Members of the committee shall be appointed for a term of 4 years. Of the members of the committee, the committee shall assist and advise the secretary to delineate statistical problems bearing on health and health services which are of national or international interest. Again, in that health community, we have to let them know there's already an international interest, and the voluntary consent of the human subject is absolutely essential. Otherwise, I may bring that forth as part of the claim. That's the first point in the 10 points handed down in the verdict of the Nuremberg trial. Voluntary consent of the human subject is absolutely essential. And now that we know this is nothing but a research project, I assure you folks, you better quit volunteering until you figure out exactly what your health is all about. Know thyself, heal thyself. When you don't know thyself, you're going to them to heal, and they're not going to heal you. They're going to give you medication, a synthetic one at that, that's going to keep you coming back. To stimulate studies of such problems by other organizations and agencies whenever possible, or to make investigations of such problems through subcommittees. See, they have no thing here for cure or remedy. It's to stimulate studies of the problems. They never mention anything about the intended effect. To determine, approve, and revise the terms, definitions, classifications, and guidelines for assessing health status and health services, their distribution and costs for use within Department of Health and Human Services, by all programs administered or funded by the Secretary. See, this doesn't have to do with your health specifically at all, including the federal, state, local, cooperative health statistics system. Federal, state, and municipal officers and agents whose resident presence is deemed necessary by the board. And of course, the board is Secretary of Commerce as the executive chair, Secretary of Treasury, and it's the Secretary or the Department of Commerce that regulates the Bureau of Vital Statistics. Referred to in subsection E and 3, to the extent possible, is determined by the head of the agency involved, by the Department of Veteran Affairs, the Department of Defense, and other federal agencies concerned with health and health services. That's over 500 of them, folks. Remember the chart? Over 500 of them. With respect to the design and approval, design of and approval of health statistical and health information systems concerned with collection, processing, and tabulation of health statistics within the Department of Health and Human Services, with respect to the cooperative health statistics system established under subsection E, and with respect to the standardized means for the collection of health information and statistics to be established by the Secretary under subsection J1. So again, it's just an information system where they're keeping track of the individual's name and number that identifies the record. It only identifies the record, has nothing to do with your health, has everything to do with the statistics and how they report them. To review and comment on findings and proposals developed by other organizations and agencies, and to make recommendations for their adoption or implementation by local, state, national, or international agencies. Or international agencies. Now we go above and beyond the federal, state, or municipal officers or agencies. to cooperate with national committees of other countries and with World Health Organization and other national agencies in the studies of problems of mutual interest. Again, that's that internationally protected person as a United States citizen, a grant of nationality, a conference of nationality upon enumeration at birth. It's a United States business created by the United States. Why the fuck wouldn't they want to protect that United States business? Why the fuck would they not teach us that very one element so they could more securely uphold their job of protecting that United States business by teaching us how to run that United States business and show that, yes, America is where you can reach your dreams. Really? To issue an annual report on the state of the nation's health, its health services, their costs and distributions, and to make proposals for improvement of the nation's health statistics and health information system. And it's the nation's health. Notice that's capitalized. It has nothing to do with you. It is not talking about your health. In complying with the requirements imposed on Secretary under Part C of Title 11 of the Social Security Act, 42 U.S. Code 1320D at sequential, shall study the issues related to the adoption of uniform data standards. Uniform data standards. Sometimes there are data that go beyond the standards, but they won't accept those. They've got to be in the standard data. So there are times they can't accept truths. For patient medical record information and the electronic exchange of such information. This is where the electronic data elements get converted to the definitive paper data elements get converted to a electronic data set, and now it creates a record through a timestamp and a security certificate, creating a creditable data, meaning it is true and factual, and you can give it credit. Oh! Shall report to the Secretary not later than 4 years after August 21st, 1996, recommendations and legislative approvals or proposals for such standards in electronic exchange, and shall be responsible generally for advising the Secretary and the Congress on the status of implementation of Part C of Title 11 of the Social Security Act. So, contract terms and conditions required to implement, that means it's a contract. Shall be responsible generally for advising the Secretary and the Congress on the status of the contract of Part C of Title 11. It's telling you Social Security is a contract, folks. And it is voluntary, just like taxes. Taxes are voluntary. Those are contracts, folks. You want to take an oath or affirmation to the Constitution, it's voluntary. Go ahead and take that oath or affirmation. In carrying out health statistical activities under this part, the Secretary shall consult with and seek the advice of the committee and other appropriate professional advisory groups. Not later than 1 year after August 21st, 1996, and annually thereafter, the committee shall submit to Congress. These are talking about communications with Congress. And this is in regards to the nation's health and insurance and stuff. And we've been subjected to it, like I said, the enumeration at birth, the assignment of a Social Security number to a newborn child, an individual born in one of the states, and a resident of the state, and conferred a nationality. That's a communication that's not being had. It's a set of data elements being put into the record. And there's supposed to be certain reports to Congress. And in those reports, that data element's in error because they were never supposed to take those data elements. Not the way they've been taking them, not under signature. If they want to take these data elements, there has to be a distinction of the nation's health and private people coming in benefiting from the nation's health program, health services program. Such reports shall address the following subjects to the extent that the committee determines appropriate. The appropriation of its value, its credence. Appropriation is an appropriation of value. And the data elements have a value. They have a credence. Are they creditable? The extent to which persons required to comply with Part C of Title 11 of the Social Security Act are cooperating in implementing the standards adopted under such part. So they're contracting the standards adopted. So they're contracting in adoption. The extent to which such entities are meeting the security standards adopted under such part and the types of penalties assessed for noncompliance with such standards. To the extent to which such entities. So again, if you're a resident or a United States citizen, you're being considered as one of those such entities, and that's why you're subject to the meeting security standards adopted under such part and the types of penalties assessed for non-compliance with such standards. Again, these are not laws, they're standards, policies, rules, codes, ordinances, regulations. Show me where they talk about law. Whether the federal and state governments are receiving information of sufficient quality to meet their responsibilities under this part. Whether the federal government are receiving information of sufficient quality, it's deficient. We are not required to give it to them, yet they're demanding and convincing us through this public education system and through our parents who also went through this public education system and were socialized in this propaganda and indoctrination to believe the same thing, that we are subject to it when we're not. It's all voluntary. Any problems that exist with your problems would be my problem. I'm not qualified. One more time. How many times do I have to tell you I am not qualified? I am not qualified. To the extent which timetables under such part are being met. Data specific to particular ethnic and racial populations. Grants for assembly and analysis of data on ethnical and racial populations. Authorizations and appropriations for health, statistical, and epidemiological activities undertaken or supported under subsections A through L. They are authorized to be appropriated such sums as may be necessary for each of the fiscal years 1991 through 2003. For activities authorized in paragraphs 1 through 3, that does sound like it's a little outdated too, doesn't it? But I assure you, this is current. This is as current as it gets, folks. For activities authorized in paragraphs 1 through 3 of subsection M, there are authorized to be appropriated. That's to be appropriated yet. Not appropriated, but to be appropriated. Such sums as may be necessary for each of the fiscal years 1999 through 2003. Of such amounts, the Secretary shall not use more than 10% for administration and for activities described in subsection M2. Secretary acting through the Center may provide technical assistance, standards, and methodologies to grantees supported by this subsection in order to maximize the data quality and comparability with other studies. That's the grantee. That's you, folks. They're recognizing right there that you're the grantee. Grantee beneficiary. The beneficiary is deemed to be the true owner. The true owner is the one that granted to the benefit, or granted the benefit to be received by the beneficiary. For activities authorized in subsection M4, there are authorized to be appropriated $1 million for fiscal year 1998, and such sums as may be necessary for each of the fiscal years 99 through 2002. Interesting. National Center for Health Statistics has to do with $1 million and not a thing to do with your health. Not one thing. So let's take a look at the next one we're going to take a look at. 42 U.S. Code 1320D, a short set of definitions. Code set. The term code set means any set of codes used for encoding data elements, such as tables of terms, medical concepts, medical diagnostic codes, or medical procedure codes. Healthcare Clearinghouse. You've won retirement and 401k annuity plan. The term Healthcare Clearinghouse means a public or a private entity that processes or facilitates the processing of non-standard data elements of health information into standard data elements. You keep giving them data elements that aren't required because they don't belong in their system, because it doesn't pertain to you, but yet you walk up and volunteer those data elements and don't know what you're doing. Guess what? You just facilitated the processing of a private entity to a public clearinghouse. And they're going to clear you out. They'll clear you out, all right. Healthcare provider includes a provider of services. Did you know that pen pal services are a unique service where you can go ahead and write a number of letters back and forth as a pen pal? Did you know that pen pal services extends that signature? All you got to do is sign that document. You just provided a personal service of a signature as an executive executing your deed, your will, as defined in Section 1395X. U of this title. What was 1395X? That is where you're born under a spell of illness, folks. A provider of the medical or other health services, as defined in Section 1395XS of this title. In any other person furnishing healthcare services or supplies, outpatient or inpatient hospital services beginning the first day. Spell of illness. Health information means any information, whether oral or recorded, in any form or medium that is created or received by a healthcare provider, health plan, public health authority, employer, life insurer, school or university, or healthcare clearinghouse, and relates to the past, present, and future physical or mental health or condition of an individual. Past, present, and future physical or mental health or condition of an individual. And remember, folks, the individual's name and number identify the record. And if the individual's name consists of a first name and a last name, it would be the legal fiction, a presumption of facts presented to the court until properly rebutted. Nothing more and nothing less. The provision of health care to an individual, or the past, present, or future payment for the provision of health care to an individual. Know thyself, heal thyself. That's the plan that's already been put out, folks. You don't need any other health plans, in my opinion. Health plan. The term health plan means an individual or group plan that provides or pays the cost of medical care. Owe no man anything but to love one another, for to love one another is to fulfill the law. And that is the plan, because I really care about you and I want you to remain healthy. Such term includes the following and any combination thereof. A group health plan is defined in Section 300 GG-98 or 91A of this title, but only if the plan has 50 or more participants, as defined in Section 1027 of Title 29, or is administered by an entity other than the employer who established and maintains the plan. A health insurance issuer, as defined in Section 300 GG-91B of this title, a health maintenance organization, as defined in Section 300 GG-91B of this title. Remember that, maintenance versus champerty. That's a maintaining of a suit for somebody else for a pay. Parts A, B, C, or D of the Medicare program under subchapter 18. Medicaid program under subchapter 19. A Medicare supplemental policy, as defined in Section 1395 SSG1 of this title. Does anybody understand any of this? Do you understand how little important this really is? Because it doesn't apply. An employee welfare benefit plan, an employee welfare benefit plan, or any other arrangement which is established or maintained for the purpose of offering or providing health benefits to the employees of two or more employers. The healthcare program for active military personnel under Title 10. Did you know that's what Social Security really is? The Veterans Healthcare Program under Chapter 18 of Title 38. The Civilian Health and Medical Program of the Uniformed Services, CHAMPS, as defined in Section 1072, Section 4 of Title 10, and the Indian Health Service Program under Indian Health Care Improvement Act. Federal Employees Health Benefit Plan under Chapter 89 of Title 5. Employees. Individually identifiable health information. Again, it's not identifying you, is it? The term individually identifiable health information means any information, including demographic information collected from an individual that is created or received by a healthcare provider, health plan, employer, or healthcare clearinghouse, and relates to the past, present, and future physical or mental health or condition of an individual, the provision of healthcare to an individual, or the past, present, or future payment for the provision of healthcare to an individual, and identifies the individual. Like I said earlier, if it's first and last name, then that individual is a legal fiction. So what are you really identifying here? Or with respect to which there is a reasonable basis to believe that the information can be used to identify the individual. The individual. Who's the individual? I'm a living soul. Standard. The term standard, when used with reference to a data element of health information or a transaction referred to in Section 1320D-2A1 of this title, means any such data element or transaction that meets each of the standards and implementation specifications adopted or established by the Secretary with respect to the data element or transaction under Section 1320D-1 through 1320D-3 of this title. Standard setting organization means a standard setting organization accredited by the American National Standards Institute, including the National Council for Prescription Drug Programs, that develops standards for information transactions, data elements, or any other standard that is necessary to or will facilitate the implementation of this part. Will facilitate the implementation, contract terms and conditions required to implement. It has to be in contract form. Operating rules means the necessary business rules and guidelines for electronic exchange of information that are not defined by a standard or its implementation specifications as adopted for purposes of this part. And therefore, when you give them that data element in electronic exchange and it is not contracted, they will take it as abandoned property and put their own value to it. Identifies the individual. Nothing more, nothing less, folks. And with that, folks, my apologies there. Get a drink. So I hope you see that all you're doing in all of your care and concern about your health, you're actually living in fear and depending upon a healthcare system that is doing nothing for you. Does absolutely nothing for you. So what are your interests in it? Your interest in it is to know it so you can defeat it. Know thyself, heal thyself. They're never going to heal you. That's not their purpose. Not once do they ever mention your health or any kind of remedy or healing for you. It's all about the record, its maintenance, its integrity, and all that. Its value. So think about this. See what you got there, brother. I got to look it up. (22) U.S. Code 257. Did I get that right? Something's wrong there. 22 U.S. Code 257. And that says commitment. No, it's not that. It's arrest of seamen. Procedure generally. In all cases, with the purview of this section for 256 of this title, the Consul General, consul or other consular or commercial authority of such foreign nation charged with the appropriate duty in the particular case may make application to any court of record of the United States, to any judge thereof, or to any United States magistrate judge, setting forth that such controversy, difficulty, or disorder has arisen, briefly stating the nature thereof, and when where the same occurred, and exhibiting a certified copy of the extract of shipping articles, roll, or other proper paper of the vessel, to effect that the person in question is of the crew or ship's company of such vessel, and further stating and certifying that such person has withdrawn himself or is believed to be about to withdraw himself from the control and discipline of the master and other officers of the vessel, or that he has refused or is about to refuse to submit to obey the lawful jurisdiction of such council or commercial authority in the premises, and further stating and certifying that to the best of the knowledge and belief of the officer certifying, such person is not a citizen of the United States. Absolute. Such application shall be in writing and duly authenticated by the council or other sufficient official seal. Thereupon, such court judge or magistrate judge shall issue his warrant for the arrest of the person so complained of, directed to the Marshal of the United States for the appropriate district. Directed to the Marshal of the United States for the appropriate district, or in his discretion to any person being a citizen of the United States, to whom he may specially depute for the purpose requiring such person to be brought before him for the examination at certain time and place. And what's happening there, folks, even though it says the arrest and bring forth, I don't know why I didn't share that. But it says right there, is not a citizen of the United States. And it says such application shall be in writing and duly authenticated by the counselor or other sufficient official seal. Thereupon such court, judge, or magistrate judge shall issue his warrant for the arrest of the person so complained of. What that is a threat to come arrest the person that was born on this land. That would be a pretty stupid arrest, and the marshals would happen to agree with it, and that might bring about an automatic and mandatory declassification and correction of the records. Absolutely. Wonderful find. I'll have to dig into this more with the codes at the bottom here, giving it its authority. But I will certainly look into it, brother. Thank you very kindly. And in the meantime, we have come to the end of the stream for tonight. Again, my apologies for being a couple minutes late here or there. Not having some of this information put together, but I'm doing the best I can, and I hope if you don't understand it, you will ask questions. Again, that's why I dropped the StreamYard link, hoping people will come up and join the panel. It's a matter of being able to discuss it openly with others. Again, I'm not posing that I'm right. I'm posing my opinion. I think it's a fairly discerned opinion. And if anybody has a problem with it, again, the panel is open. That's why I leave it open so other people can criticize my research and stuff and help enhance what I'm putting out so that I'm not leading anybody astray or in error or anything like that, particularly myself. I don't want to sound like I'm a babbling idiot. So, again, I hope everybody's paying attention and doing your research. Don't believe me. Don't believe the neighbor. Don't believe the government. For crying out loud, don't believe your mother. Do your research so you know, and know that I love you, but I don't give a rat's ass whether you love me back. That's on you. If you don't respect me and don't like me, I don't care. So may God bless you and have a good night. We'll see you next time.